Hello everyone. Today let's understand the Glasgow Coma scale in the simplest way with examples you will never forget. So basically, Glasgow Coma scale is a medical assessment tool used to measure a person's level of consciousness after a brain injury or in other conditions affecting the alertness. It has three components in it: the eye opening, the verbal component and the motor response. So let's see one by one. Let's start with eye opening. Eye opening tells us how alert the brain is. It has 4 points in it. So, the fourth score is given when the patient opens his eye spontaneously. That is, the patient looks at you even before you call them. Score 3 is given when the patient opens his eye when you call them. Score 2 is given when the patient opens his eye only to pain. And score 1 is given when the patient has no eye opening. The second component is verbal response. It checks the orientation and the speech. It has 5 points in it. Score 5 is given when the patient is oriented to the name, place and time. Score 4 is given when the patient talks but a little confused. The score 3 is given when the patient talks random words, that is inappropriate words. Score 2 is given when the patient gives incomprehensible sounds, and the score 1 is given when the patient doesn't produce any sound. And there is another terminology in it. If the patient has tracheostomy or intubation, it is documented as 1T, that is 1, that the patient produces no sound and the patient is under tracheostomy or intubation. The third component is motor response. It is the most important part of GCS. It has 6 points in it. The score 6 is given when the patient obeys your command. The score 5 is given when the patient localizes the pain. The score 4 is given when the patient withdraws to pain. Score 3 is given when the patient shows abnormal flexion, that is decortication. Score 2 is given when the patients show extension, that is decerebrate. And the score 1 is given when the patient shows no response. So putting it all together, we should add all the three components and we should arrive at a score. So the interpretation comes like this. Score 13 to 15 is considered as mild head injury. Score 9 to 12 is considered as moderate head injury. And the score 3 to 8 is considered as severe head injury or coma. So let's see some examples. A 25-year-old man fell from a bike. When you enter, he opens his eye immediately. He speaks normally but a little confused about the time. He follows your command, lift your hand. So, we will see the answer. The patient opens his eye spontaneously, that is, opens his eye immediately before you call him or before you had a talk with him. So, the score is given as E4. Then, the verbal response is 4. That is, the patient speaks normally but a little confused about the time. The motor response is 6. That is, the patient is obeying your command. So, the overall score is 14 out of 15. The patient is having mild head injury. Let's see another example. The unconscious patient brought to a casualty. No eye opening, only groaning sounds and shows abnormal flexion to pain. So the score is, for eye opening, we give 1 because the patient doesn't open his eyes. Score for the verbal response is 2. That is, the patient gives only incomprehensible sounds. That is, he produces only groaning sounds. And the score for motor response is 3. That is, the patient shows abnormal flexion to pain. That is, he shows decortication. So the overall score is 6 out of 15, which is the patient shows severe head injury or coma. Hope you all liked the video. Have a good day. Bye.